Well, I am particularly excited for our podcast today. My name is Valerie Humes. I'm the director of the Maternity Housing Coalition here at Heartbeat International. Thank you for tuning in to the Pregnancy Help Podcast.
Hey Kim, it was great sharing our Go for the Gold program at Heartbeat this year.
Yes, Go for the Gold is a sexual risk avoidance education program that teaches teens healthy relationship skills.
Call us today at 937-262-7010 and let's go for the gold together.
Today, our episode is with Vanessa Rock, who's Chief Operations Officer with Counsel Homes. And we are going to take a little bit of a dive into one of my favorite subjects, which is mental health. And Vanessa is going to allow me to ask her some questions to understand maybe some feasible ways that we could support mental health for our residents. Now, one thing I want you to know for this podcast is that we will often refer to homes and residents because Vanessa and myself both serve in maternity home settings. However, we recognize that this information is applicable to pregnancy help organizations across the board. So if you are serving in a pregnancy center, feel free to tune in as we feel this would be greatly helpful for you as well. So, Vanessa, did I say your title right?
Yeah, you actually did. You said it very well. I guess I'll piggyback a little bit off of what you started to share. So yeah, my name is Vanessa Rock, and I have the distinct pleasure of being the operating officer for programs at Counsel Homes in New York and New Jersey. We are a residential maternity program which houses pregnant and or parenting women and their children. And our goal is to aid them to self-sufficiency and independence, right? Our only criteria for welcoming moms into the program is that they're pregnant, parenting, and homeless. So to that end, we tend to support moms who otherwise would really not have anywhere to go or will not be able to get some of the supports that they need. And these are moms who can have mild to severe mental illness, moms who may have substance use disorders, at times moms with developmental disabilities. And so this topic for me is really important, really relevant. And I'm just excited to be here. So thanks for having me.
Yeah, absolutely. So let me go ahead and introduce the topic because it has one of my favorite titles to it. So we are going to be talking about mental health first aid. Mm-hmm. And I fell in love with this phrase whenever I heard it. So Vanessa, why don't you start there? What is mental health first aid?
So mental health first aid, it's a course that teaches you how to really identify and understand and really respond to signs of mental illness, signs of substance use disorder. The training itself will give you the skills you need to reach out and provide like the initial helping points to some support, just really to support someone who may be having a decompensation period, someone who's experiencing some sort of mental health or substance use disorder crisis, right? So I think people sometimes wonder, like, who takes this training, right? Like, why mental health first aid? And it's really a training for everyone. We were talking a little bit earlier about how you don't have to be a clinician. You don't have to be a social worker. Teachers take the training. First responders take the training. People who have loved ones with mental illness take the training. Pretty much anyone who wants to make their community healthier, happier, and safer, right? Most of us would know if we were witnessing someone experiencing a heart attack or some sort of crisis, we would say, oh, well, we've got to start CPR, right? or at the very least, we're going to contact 911 or reach out to some sort of first responder. But not a lot of people know how they would respond or should respond to someone having a panic attack, someone who might be experiencing mania, a friend or a coworker who might be showing signs of alcoholism, right? They don't know how to respond. And so mental health first aid, this training, it takes kind of the unknown and the fears and hesitations away from those circumstances, right? It allows us to be able to have conversations about mental health, conversations about substance use disorders or problems by providing like an understanding. And really the key here is an action plan that teaches people how to safely and effectively respond to these types of situations. So that's kind of in a bubble, exactly what it is.
So when you talk about it, what comes to my mind are some of the basics that we have. Like, for many of us, our staff may do CPR training, particularly with infants in the home. Mm-hmm. So we'll do CPR training and then infants, CPR training. I know a lot of times we'll do maybe like a medical, first aid kind of 101 with that. So that's what comes to my mind. Is this comparable? We're saying this is mental health, like if we had a CPR or first aid, right?
That's exactly what it is. It's exactly that. It's your first line response to a mental health crisis. What do you do? How do you respond? Where do you go? What comes next?
I really love that because all you need is to learn a couple of first response maybe strategies that could help change a circumstance. And so that feels like relieving.
Yeah. I love that you use the word relieving because as I was saying, it really takes the hesitation out of even wanting to respond, right? Oftentimes people don't respond, not because they don't want to, not because they, don't have a heart for people or don't have a heart for what's going on in a circumstance. It's because they're afraid and maybe don't have the strategies, right? The action plan, the tools, right? To be able to address whatever's in front of them at the time. So I do believe that this is an action plan based strategy training that provides that kind of support, right? You have it in the back of your head. When it presents itself, you're already, be shot into gear on what comes next. What do I do in order to address this?
So here's my next question for you. Mm-hmm. In deference to sounding with an overly simplistic question, but why is this important? And let me tell you why I'm asking that. As in, can you paint the picture for us? What happens when someone doesn't have this information or training?
Yeah. It's a twofold question. And I think the simpler the question, the simpler the answer, right? So in 2020, the National Alliance on Mental Illness statistically shared that about 20% or about 21%, I think is the exact number of adults will experience or have mental illness. And we're talking 52.9 million people, right? That's roughly 1 in 5 adults. So if you walk down the street today and saw 5 people, it would be feasible to believe that one of them might have a mental illness. And so it's important because we're seeing mental illness more and more. This is not an anomaly. This is not a situation that exists way over there. It's in our everyday. It's a part of our lives. And so it's just prudent for us to be like alert, to be empathetic, to be knowledgeable on how we would support or present in a situation like this. So let's paint a picture, right? You are working as a front-facing staff, or you're, just walking down the street, perhaps with a mom, with a baby, or with someone who may or may not be diagnosed with mental illness. And that individual starts to show signs and symptoms of decompensation. And decompensation is just a fancy way of saying this person is experiencing a crisis, right? You're witnessing these signs and symptoms. If you're trained in mental health first aid, number one, you'll be able to pick up on those signs and symptoms. You'll be able to say, oh man, this person might be experiencing a crisis. And then you'll use some of the tools that are shared in the training with how to speak to the individual, what helps with calming them down, what helps with probing to figure out what type of crisis they're experiencing, right? You can also use the training tools and techniques to be able to figure out what kind of assistance they need. Perhaps it's, you realize it's not a medical assistance that they need, but perhaps a psychiatric assistance, perhaps a substance related assistance. And so, again, having those tools will essentially put you in the framework to be able to address how I can help this person who's sitting in front of me, who's walking down the street with me, to be able to reach a level of, a point where they're not, having a full crisis, because you're able to de-escalate them to the point that they can be apt to get the help that they need, right?
Yeah, that makes perfect sense. And it brings me to this thought of, if you will, how does this relate to maternity housing specifically, particularly as most maternity homes now also have infants or children in the home, as well as, women that are either pregnant or postpartum, maybe a mix.
Yeah. So great question. And I think we'll paint another picture here, right? So you are in a maternity housing program. You have young children, you have toddlers running around, and then you also have the women that we serve. These women can be diagnosed, right? Or they can be undiagnosed. And so when you're having these women in a maternity program around other women, around triggers that you may or may not know about, you're in a situation where perhaps something could be triggering to the individual. And the first line staff, right, the front facing staff are going to need to know how to respond. How do we de-escalate someone who might be triggered by a conversation, who might be triggered by a smell, who might be triggered by a person, right, a situation even, who might be triggered by other children. The best bet is our best bet rather is to want to provide support and a safe environment for everyone who's involved. And so again, this training is going to equip us with the ability to say, okay, first of all, I know I have to remove this mom from maybe general population and pull her aside to be able to address whatever crisis she's coming to, right? It's beneficial to residential programs, but I also kind of believe that it's beneficial to pregnancy help centers as well, right? They're often coming into contact with women for services. They don't always know who the person is, right? Sometimes our first encounter is our last encounter with some of these women. And so same thing, right? Having training for all the front-facing staff is only going to be beneficial and provide them the confidence to support like this delicate population.
Yeah, whenever you're talking, it really makes me think of just kindness, that fruit of the spirit that is kindness, and realizing that this is something we can choose to do. This being equipping ourselves, and we can choose to do in order to be ready at any time to be an encouragement to someone else. One of my favorite phrases that I learned from some mentor somewhere that I've used forever is that encouragement means to put courage inside, to put courage in. And so I was thinking about that when you gave the example of a panic attack, which is so common, or a smell being triggered. And, that takes them to a very real experience mentally. And how great is it that we can have an opportunity while they are having what is probably a very harsh and pleasant experience in their mind. They're back somewhere, with whatever that memory is.
Right.
But we have an opportunity to show them gentleness in that time and to show them kindness and softness and compassion. I guess I was just connecting the dots, realizing in the instance of someone being triggered, when that first instance happened, they likely didn't have any gentleness around them. But whenever this happens around us and we're ready, now the story can be different. Now they can have an experience of gentleness along with whatever that negative experience was. And I just kind of gave me a different perspective. Like, what a great opportunity and low hanging fruit, if you will, for us to kind of add this to our tool belt.
I love the way that you described it, right? Because a lot of us are already doing some of this and we're just not calling it mental health first aid, right? We approach our moms and the women that we serve with empathy. We approach them with compassion. We try to be, supportive to whatever it is their circumstances are, so that we're able to be just a blessing in their lives, even if it's for a minute. And so I believe that the training is just going to couple with the characteristics of the population of people that work in this field, right? It's just going to kind of go hand in hand with some of the things that we already encompass. And I love that, Val. Low hanging fruit for sure.
I'm curious. I want to hear your thoughts on something. I get to spend with my job lots of times with people at homes all over the nation. And so I get to hear sometimes what some commonalities are. And often I hear sometimes a sense of overwhelm, especially for startups, with recognizing not only the presence of mental illness, but rather the prevalence of mental illness. And as we're talking about it, sometimes affiliates will really express how exhausting or daunting it can be to feel like, I just want to help pregnant women and their babies. And so I guess at this point, we're just talking more just in general kind of coffee talk. But I'd be curious to hear your thoughts on that, because one thing that stood out to me is I heard you say you only had one thing that was required for women to move in. Well, two, suppose, pregnant and homeless. Which leaves a very wide net for different mental health needs and the the potential for mental illnesses to be present in the home. Yeah. So, do you want to just talk about that? What would you say to some of those homes that are feeling overwhelmed with just the prevalence of mental illness in residents?
Oh, absolutely. Daunting? Yes. Overwhelming? Yes. At times, scary even, yes. All of those emotions are very real and very true, and necessary. But for us, I believe we take those emotions and we channel them into education, and we channel them into training. A lot of times the fear comes from the unknown, right? Oh man, I don't know what's going to happen. I don't know what this means. I don't know what the reaction is going to be. And so if we train ourselves and we equip ourselves, it removes some of those unknowns, right? You don't know everything, right? Only God is all knowing and all powerful, right? But you're able to say to yourself, well, I know what a decompensation might look like for someone with bipolar disorder, or I understand what some of the signs and symptoms of schizophrenia are. Or I understand, what addiction means and what it may look like and how it may visualize itself in a mom in my home. And so when you have those knowledge-based nuggets, right, you're less apt to feel overwhelmed or daunted by it, because you're able to say, well, I know what to do here, right?
Right.
And every circumstance is going to be, it's going to be different, right? Moms are going to be all different. We're all complex human beings. But again, I don't believe you need to be a complete clinician. And listen, I love clinicians. I'm a social worker, so I definitely believe in the field, but it's not absolutely necessary as long as the basic training is provided, and people really understand at least the core of how to respond to some of these things. And so I encourage startups to, just really start with the education piece, just start with the training piece. It's a good starting point, and as you get a little bit more comfortable and knowledgeable, you'll see that it's 100% doable. And these women need our help. They need us. So we've got to just do what it takes to be able to meet their needs.
Amen. You're speaking my language now.
Yeah.
Okay, so how can homes learn more about this training?
Okay, so the training itself, I believe it was developed by the National Council for Mental Well-being a few years ago. And during that time, there was a huge push to educate the masses, right, across the nation. And so a lot of states and counties actually hold the 8-hour training. It's a full day's training pretty regularly, right? Most of the trainings are going to be low cost, or they're going to be they're going to be free because they're going to be funded through grants by the state. And so in order to find these trainings, I really encourage like a quick Google search. You can Google mental health first aid in your state or in your city or in your county. And it's generally going to be easy to find. A lot of these trainings right now are still virtual, or they'll have like a blended component. And so even if you're, let's say, in Texas, you might be able to register for a virtual training that's being held in New York. As long as, you have the full 8 hours to contribute. There is often a pre and post test. And there is a certificate that they give you that lasts for about 2 years. And then, every 2 years, we do encourage a refresher just to kind of be up on whatever's new for that time.
Awesome. Well, I hope everyone took note of that. And as I come across resources, I will be posting those in our Facebook group for the Maternity Housing Coalition. And for further discussion or questions on this topic, as always, feel free to email me at housing@heartbeatinternational.org. So Vanessa, thanks for your time today. I really appreciate it.
No, thanks for having me. I love this topic, and I'll be happy to talk about it anytime.